Thank you, Chair Cox, and good afternoon. I want to start today by reiterating the points that we've made a number of previous days, is that we are going to see fluctuations in the numbers. We're going to see ups and downs, and the daily numbers do not tell us a tremendous amount, but we should prepare ourselves for both ups and downs. Today we're going to report 98 positive cases, which is our highest total in the last 5 days. Which is not any more a cause for alarm than a lower total from a couple days ago is a cause for relief. The only cause we care about is the cause that is truly committed to doing the things that we know that we have to absolutely do, at least for the month of April, to truly flatten and bend the curve. When you look at areas around the country that are struggling, you see really tragic circumstances in Detroit, where you have folks who are literally dying in the hallways of hospitals due to a lack of available care. You see the challenges in Philadelphia, Louisiana, Colorado, and New York. It is important for us all to remind ourselves daily that the coronavirus is equally contagious in every single place. It is not more contagious in Italy or China or New York than it is in San Diego. In San Diego, we are not seeing those scenes play out because we moved swift, we moved early, but more so because each and every one of you out there, or a significant number of you out there, adhered to the guidance. Because of your adherence to the guidance, we are in a better position. But the moment at which we become complacent and we stop adhering to that guidance is the moment at which our trajectory changes, and we very well could be on a pathway like we see in those other jurisdictions. And so we continue to ask for your ongoing commitment as we work through these issues, to remain vigilant, to remain committed, and to ensure that we will get through this. We will come out of this, we will rebuild, we will rebound, but the speed at which we can begin that process is directly impacted by the level of commitment, ongoing commitment that we have through at least through the month of April here in San Diego, and so we want to reiterate that call. I want to clarify or add on to a couple amendments to our public health order. We certainly hope that all San Diegans are adhering to the strong recommendation to have a face covering anytime they leave their house, whether that be to go to an essential service like going to a pharmacy, a medical appointment, or a grocery store, or whether that be going to an essential form of employment. We strongly encourage all San Diegans, anytime they leave their house, to have a face covering, but we have amended our public health order to include employees of a few additional businesses where it is a requirement that the employees of those have face coverings. That includes banks and public transportation employees, which include our traditional public transit entities like MTS and NCTD, along with our transportation network companies, which include rideshare companies like Uber and Lyft, taxis, and any other entity that might provide transportation to the public. So businesses that are covered now include restaurants, grocery stores, pharmacies, convenience stores, gas stations, and now banks and entities providing public transportation. This revised order will be effective Monday night at midnight. I want to just take a minute. We've been, as an entity, providing a tremendous amount of data to the public in real time. We daily strive to be transparent with what we know and provide it in as many formats as possible so that the public can be informed of the situation and circumstances that we face. I believe as a jurisdiction we are doing significantly better than perhaps any other jurisdiction in taking complex information that comes in an ever-changing format, distilling it down and sharing it as quickly as possible in as many different configurations, whether that be the data we're able to break down by race or gender or ethnicity, the data we're able to break down by city or jurisdiction, in an effort to continue to strive to provide the public with easy-to-consume information about the situation here locally in San Diego. Today, we are releasing an interactive dashboard. This dashboard takes a lot of the information that's available now and simply puts it in a little bit easier to utilize and easier to visually see format. If you go to our normal website, coronavirus-sd.com, you will see in the top left-hand corner there a blue box, Coronavirus in San Diego. If you click on that box, it takes you to the Coronavirus in San Diego landing page, and there you see in bold blue font, County of San Diego Coronavirus Dashboard. If you click on that link, it will take you to the dashboard. And what you see graphically displayed here is a configuration of our total confirmed cases. You can see reported tests, hospitalizations, and ICUs. Those are cumulative figures that are right there in the middle of the chart. On the right hand, we'll get to in a second, is some geographic breakdowns of those. And then on the left hand, you see two charts that represent total cases and new cases, along with hospitalizations, ICUs, and deaths. If you click on that top left-hand portion, you can see a blow-up portion, and this will show you the total cases cumulative along with the new cases by date. And you can scroll along there and see the day-by-day trajectory and see where we were at each point in time in our evolution through this episode. If you go and extrapolate the bottom left chart, this chart shows you the information around hospitalizations, ICUs, and the unfortunate loss of life, again in a day-by-day chart, so you can look back and see what the totals were at any day in our evolution through this endeavor. In terms of the geographic display, you have two options on the right-hand side for the geographic display. Let's take a look at the one that is by jurisdiction. So this shows the total confirmed cases by residency, and you can see that. You can click on an individual one and get a little pop-up and see a list along with the nice chart across the bottom that'll show the day-by-day trajectory for that particular jurisdiction. And then after we provided jurisdiction, we had a request for information by zip code, and you can also see and access that information here, where again you can look at a zip code and see the particular tracking. We also have in the center part of the dashboard, if you click across the bottom, you can look at a total confirmed cases by California county, and you can see where we are in relationship to other county. And I believe we are working to adjust this based on population so that you can continue to get an update there. Again, I want to reiterate a couple of the key points that the zip code data, while we want to share it in an effort to be transparent, is not particularly informative as to the true scope of what it is. It is informative as to the scope of what we are aware of. It is informative as to individuals who were able to obtain a test and the zip code where they list their residence. It doesn't mean that's where they are. It doesn't mean that's where they acquired it. And the same is true with the jurisdictional data. And then as it relates to the testing by counties, I just want to point out that San Diego County, although we continue to want more testing and we continue fighting to get more testing, recent reports have indicated we are doing more testing than any other county in San Diego County. And so our numbers relative to other counties are going to be disproportionately high just because they're not adjusted based on the availability of testing. The fact that we're doing more testing is a good thing for San Diego County and certainly something that we want to continue. Given all of that information, we're going to quickly run through our charts today. Today, as I mentioned, we reported 98 new cases to bring us to a total of 1,628. Our total number of tests in San Diego County is now approaching 23,000. We're at 22,098. And again, these get reported in batches. Here you can see the total number of tests versus total positives. We are holding steady there at about 93% of all tests are coming back negative. And then the next chart is just our positives along with our hospitalizations, our estimated recoveries, which we have covered at length. That is an estimation. ICUs and the unfortunate loss of life. We're reporting 4 additional deaths today. Our ICU bed rate is currently doubling at about every 8 days, hospitalizations doubling about every 7 days, and positives doubling about every 10 days. Again, those are encouraging numbers, but they should only encourage us to continue doing what we've been doing in an effort to make sure that the trajectory that we're on continues and does not reverse. Motel rooms, a slight uptick in public health rooms occupied and number of guests. Regional task force on the homeless rooms, we had an error in our slide yesterday, just a typographical error. We have corrected that. Yesterday's slide represented a wrong number. Today's slide represents the correct number. Outreach efforts, increases in 211 calls, nurse calls, epi calls. Hygiene kits remain the same. Slight increase in the number of hand washing stations and toilets distributed remain the same. Personal protective equipment, an increase in every category here. N95, surgical face masks, face shields, goggles, gowns, gloves, all an increase. We are approaching 2 million individual items of personal protective gear being distributed, and we continue to push to get more. We've been encouraged by the release of the state in terms of what they are expecting to come. We certainly hope that that comes soon. because a number of entities are beginning to run low, and so we will continue to fight to get as much personal protective equipment as we can to fill the need for our region. Ventilators down a little bit today only because 2 of the hospitals did not report by the time we prepared today's charts. That is the end of my report, and I will now turn it over to Dr. Wooten for our Public Health Officer's report. Thank you.